I'd like to welcome and thank everyone for joining us as the Economic Club of Las Vegas hosts Alex Ritson, who will be covering COVID-19 globally. The Economic Club of Las Vegas is a non-profit, non-partisan forum for economic discussion. We bring experts on regional, national, and international issues to our Las Vegas audience, allowing us to hear from the experts and often our own questions and ideas in return. The club was formed in 2013 and is also an affiliate chapter of NABE, the National Association for Business Economics. Before we begin, I would like to recognize the hard work of our board and officers. Without their commitment to the club, these events would not be possible. I would also like to thank our sponsors for their generous support, both in terms of financial support and in helping spread the word about the club. The agenda for today includes a 15 to 20 minute presentation from Mr. Ritson, and then we will have a moderated Q&A afterwards. At any time during the event, please feel free to submit questions to our moderator, Ken Heck, who will organize and present all those questions to Mr. Ritson after his presentation. Mr. Ritson is a reporter and presenter of the newsroom on World Service Radio and Radio 4, live on air. He was live on air during the bombing of the Manchester Arena. He's a regular ad hoc newsreader on BBC Radio 2 and an ad hoc presenter of the World Service Breakfast Show, Newsday. Previously, he held roles as deputy editor of the BBC World Service Business Program and the BBC's business correspondent, India, Brussels. With no more ado, I would like to introduce Mr. Ritson.
Thank you so much, Jason, and thank you so much for joining us today. It is a real honor to speak to you all, and I have had such fond times in Las Vegas on the times that I have visited there. You have whetted my appetite for a return visit. It is just an extraordinary city. I think possibly the most fun I've ever had in any part of the United States. Just before I start, and I even stuck a page in the presentation I shall play about this, I must just stress, I am not a BBC spokesperson. I am, if you do detect any views, and I shall aim always to make sure that you don't, they will not be the views of the BBC. I am not authorised to be a BBC spokesperson. That is because I work for the BBC News Department. They employ us as journalists, but very often we report even on the BBC, and we cannot do so if we are its spokespeople. So the BBC's views are very much separate from mine. Now, I've put together a short presentation. I'll talk you through this, and then I will look forward to speaking to you, taking your questions afterwards. So if I can just open this up on my PowerPoint. We're all getting to learn how to use Zoom so much more efficiently than before. And I start with that disclaimer. I am not a BBC spokesperson, and the views expressed in this presentation are not necessarily the views of the BBC. The BBC doesn't tend to have views on anything. Also, just important to give you a sense of how the BBC is funded. Every household, pretty much, in the UK has to pay towards it. It is not, however, funded by the government. This is a general collection of money from every household, but it is not done by the government. It's done by a separate commission. The government actually has no control of this money. We are possibly the biggest thorn in the side of the government. That is the whole purpose of the thing. We are there to be a check on power, as journalists are generally, but we are by royal commission set up, and we have all sorts of rules that we have to follow on impartiality and on trying to serve every part of the audience. So for £163, which is what, about $200 back in 25 years ago, today price has actually gone down slightly. So for less than $200, the population of the UK and the world get all these TV stations, all these radio stations, and then all sorts of digital services as well. So it compares very favorably to many other commercial operators in terms of the offering for the price that you get. However, it is something that people in the UK have no choice but to pay for. You'll see the BBC World Service logo down there in the bottom left-hand corner. The World Service is both a radio station and a TV station, and there are international services on the website. Why do we provide this at no charge to people around the world? Often my own program, The Newsroom, goes out on your NPR networks. I guess it is just our mission to inform, educate, and entertain. And ultimately, there is an element of soft power for Britain. I guess if you hear our news, if you see our programs, if it makes you think that British people are decent people who are likely to be honest and likely to work with you well if in business, then that's good for the country as a whole, and again adds to that value for money that people in the UK, we would like to think, recognise even more so in the aftermath of this crisis of COVID-19, which has been the biggest news story of my lifetime. I think this news story of the coronavirus is the biggest thing in the world pretty much since World War II. I know there have been many other stories. Other countries will have had their own things which seem huge, but it's the first really global story since World War II. And I have done whole programs, whole radio programs, we have done whole TV programs in which there has been nothing other than the coronavirus and different stories going all the way through it. I've never known anything like that. There'll be occasions where I've been on the air and we've had a major bombing or there's a war happening, and on those occasions when it starts, maybe there's a full hour, we will go rolling, as we call it, but to have day after day, as we did for a couple of months, whole programs with literally no other story in there, is something I've not seen before. I mean, in the end, it's the reason that I suppose you go into journalism. It's for that moment, because so much has changed in the way that we've been reporting stuff. We've gone to an emergency schedule, which is being sort of pulled back a little now, but it has felt like reporting on a war. And these headlines, coronavirus, how South Korea crushed the curve, outcry after Trump suggests injecting disinfectant, Boris Johnson, who was in hospital just a mile from where I am sitting now, and there were serious concerns about whether he would make it through that, which it was just extraordinary. Then the whole row over the hydroxychloroquine, the moment when this all sort of started in the Western world, when northern Italy put 16 million people into quarantine. I was doing the breakfast show on the World Service that day, and we'd never seen anything like that. I mean, it was just unprecedented, the idea that people could be told to stay at home by the government and that they were facing criminal penalties if they went out. Brazil's Bolsonaro sees second health minister quit. We're going to talk a little about the handling and why we pick the stories that we pick during this presentation. And actually, that is a really important issue in itself. On this, just the most extraordinary story of all. President Trump has been a very interesting part of our news coverage. He is the most powerful man in the world, and it's been extraordinary watching some of the things that he has said. They have been immensely newsworthy. They've been leading programs not just in your country, but in every country in the world, because the world often looks to the United States for leadership. And so the things President Trump says are going to have massive implications for the rest of the world. And this particular story is just extraordinary. Is it true? I've no idea. But President Trump has said it. Mike Pompeo has said it. Your Central Intelligence Agency seems to have distanced itself from what they've said. But then a former head of our main intelligence agency, MI6, has suggested that there may be something in it. And whether there's something in it or not, this is going to be a story that is going to run and head news programs and cause all sorts of other stories going forward, because the relationship between the US and China, if it's true, then it's going to damage the relationship. And if it's not true, it's going to damage the relationship. And a bad relationship between the US and China is news for the rest of the world for obvious reasons. These are extraordinary times, and where this is going, well, I do not know. It is a story that just keeps on going. And as we all know, the fear now is of a second wave. Coronavirus feels a little quieter now, sadly, because of other events that are going on in the world. It's not top story anymore. But that's not to say that this is over. I imagine that at the start of World War II was top story. And then there was that period that they called the phony war. And then it came back again. So I'm not sure at all that coronavirus really has slipped all that far down the headlines. How do we decide what goes in our programs? Well, actually, I mean, what is news is a question which we get asked many times. And it takes years before you can, when you're working as a journalist, before you really know what it is. It's not that we decide something is news. It is news or it isn't news. And it takes years of experience as to decide whether or not something goes up at the top of any news bulletin. Briefly on that, I suppose the two factors which would go into any news story are: is it interesting and is it significant? If the answer has to be yes to at least one of those questions, it really has to be yes to both of them if it's to go at the top of the story or even in the bulletin at all, because there are all sorts of things happening in the world every day, and they're not news. And it has to meet those two criteria to get into any news program. There's another competitor of the BBC, an American competitor, which actually I think has given the best definition of what a news story is that I've ever heard. And for them, news is a new surprise. And so actually, if you're ever thinking of pitching me a news story, and I will ask you to do that at the end, if ever one comes across your way, I may say it differently to you. If it's something that's gone on in your business and you think it should be top of the bulletin, ask yourself if for everyone else it really is a new surprise. And if the answer is no, then it's not news. It might be very important to you. It might be a very worthy issue, but it won't be news. Now, to get back to COVID, this actually American university webpage has been immensely helpful to us in working out where things go in bulletins. It's the Johns Hopkins University coronavirus map, and it has this huge list down the left-hand side, which just shows you how many confirmed cases there are in the world at any one time, and it does so by country. And you will see that there is a strong correlation between those countries which are up there in the top 10 of the list compiled by the university, and those countries where there have been very large numbers of coronavirus news stories featured in our global bulletins. I mean, the US has most cases in the world, and at the moment the greatest number of deaths, and because of that, what goes on in the US is immensely significant, and there will be stories that come from there. It's also interesting, though, the other page we use rather regularly is the Worldometers page, and the Worldometers page actually uses the same data, which comes from the WHO as it comes in, but allows you to sort based on the columns along the top there. And the one that I tend to sort, which is really useful, is the one which does deaths per 1 million population. And that actually tells you just how serious the disease is in any particular country. And you'll see there, actually, the US falls down the chart quite significantly. I mean, it's still up there in the, well, it's number 9, or at least when I took this screenshot, it was number 9, which was a couple of days ago. And San Marino, bizarrely, up at the top, although I think that's more because there's a small number of people who live in San Marino, and so a small number of cases goes a very long way. But yeah, the UK doing very, very badly, really behind only Belgium in terms of countries which have been very, very much affected by the coronavirus. It's been huge, though, for our audiences in the UK and around the world. We're yet to do really comprehensive global research on what people liked and what they didn't like about our coverage. So what I'm going to present to you is coverage, is research that was done in the UK, but it was statistically significant research. And I'm going to guess, given that we use the same kinds of editorial judgment on stories, that the kinds of things that people say will ring true with our global audiences as well. So the thing which the BBC has done particularly well with in this age of social media is trust. This is probably good news for our competitors like CNN in the US and many of our newspaper competitors. The trust that people have for the BBC has been massively enhanced by the fact that they can see what we do, and they trust it to be a fair and accurate assessment of what is going on in the world at the moment by professional journalists. Contrast this with what was going around, particularly at the start of this crisis on social media. We've been aware of the dangers of news circulating on social media for a while. I'm sure you've read the stories, and also the stories about the echo chambers that create, but just pure fake news. I mean, it's one of President Trump's favorite phrases. He uses it in ways that we don't necessarily agree with, as you'll appreciate, but it is a real thing. And I remember at the start of this crisis, all sorts of bits of stuff being forwarded to me on social media by people who I trusted, who don't work in the news, but people who are sensible people. A notable one was where one of my sisters forwarded me a video of panic buying at a shop supposedly in New York. And it was a scary picture. It was queues down the street, people wanting to get in, and then coming out with trolleys laden with toilet roll. There are now bits of software which you can use if you know how to use them, like TinEye, which will show you where these videos originated. This particular video actually came from the Netherlands, and it was about 10 years old. And it was people waiting for some kind of summer sale in a supermarket over there. But it was sent around and actually may have been responsible for what became a real news story. That panic buying, which went around the world. There was a period, I think the UK was affected even worse than parts of the US, but I know you had it badly too. You could not get toilet roll here for about a month. It was just crazy. So yeah, the public have become, all our audiences have gone up massively. We've done special coronavirus podcasts, and we've had news programs focused on this, and people have appreciated it because they can trust it. People like the fact that we have gone out of traditional news, made explainers, told people how to tell if they've got the coronavirus. And some of these pieces, people register that they're there, they go back to them later, and it means that they know what to do. And there has been definitely an element of public service broadcasting, a large element of public service broadcasting in what we do, although not the sort of public service broadcasting that the government likes to put forward. It's us as independent people working out what people need to know, and they have appreciated the way that we've done that. We've interviewed not just politicians, but experts directly. And I've interviewed the doctors at Oxford, who are one of the groups who are most advanced in the search for the vaccine. I've interviewed people who have been in charge of entire operations in countries in Africa to safeguard the local population. And these interviews are always the ones, when we put them up online, which get the massive click-throughs. It's also interesting just how the interviews that we've done with politicians have, maybe the start has changed. Prior to this crisis, the BBC was on a massive collision course with government. I think every government comes in thinking that the BBC, well, it's when there's a changeover of government, the opposition thinks that the BBC is their friend. Because for years we haven't had to criticise them. Then they come in, then they take office. And suddenly they're the ones that we're holding to account for the general population. And they don't like that. And that led to a serious standoff and serious efforts and suggestions made by Boris Johnson's government that the BBC's funding pattern might be changed in the future. It was a threat, and it was a threat, and they stopped putting ministers up for interview on our programs for a time, on the Today program, which is the main news program in the morning. The coronavirus crisis has changed that, and maybe politicians are starting to understand just how important it is too. But it's changed the way, perhaps, that we've done some interviews, because it is probably a good starting point to think that most politicians in a crisis like this are trying to do the right thing. They're trying to get through a situation that is completely new. And, well, let me just play you two different interviews, one done by us and one done by a man you may know, great friend of Donald Trump, Piers Morgan, who is a British TV presenter. I think they've fallen out. You'll have to Google about that. But take a look at the BBC one first, and then the Piers Morgan interview, which when we did our audience research, people really didn't like.
You say they're on the front line, and yet, and understandably, I'm sure many care workers watching this morning would say that you prioritise the NHS is understandable. But is it a front line that you have ignored for too long? Has this come too late? There are more than 2,000 care homes in England alone that have cases of the virus.
It hasn't been ignored at all. It's been harder to talk about it in interviews like this, because I found in recent weeks when I've been interviewed, almost everybody has spoken their questions on the NHS, and I've tried to talk about what we're doing for the care sector, and it's harder to get heard. But actually, we've been working really hard, night and day, to make sure that we're doing what we can for the care sector, and that's one reason why we're able to make the announcement today on testing and offering more testing both to people working in the care sector and also residents in care homes. As our testing numbers are going up, that's an absolute priority, going right to the front of the queue for tests, because we recognise it's so important to look after really vulnerable people and also the workforce looking after them.
So I'll give you an example of what there's one person who's got in contact with us. They are in a care home, they work in a care home, they have no PPE, absolutely nothing. They put in massive orders in February, but it all got, understandably they say, diverted to frontline staff in hospitals. Now it's April, they still have nothing from any source, either NHS or private manufacturers. They say, at what point will you, the government, realise that these people, as you said, are on the front line? They have nothing to protect themselves.
Well, firstly, can I ask them to get in touch, because we have taken huge steps to get PPE, personal protective equipment, out to the care sector.
Okay, so contrast that with this interview. Same minister, same morning, but Piers Morgan, the interviewer, on our rival.
Well, I assume you're doing all that, but is it true that 4,000 people have died in care homes? Yes or no?
Okay, well, I'm glad you appreciate that we are doing that. I think it's really, really important. to take the steps that we
No, I'll
can.
tell you what's really important is that you just answer straight questions. Is it true that 4,000 people... Why are you laughing?
I'm coming to answer your question, but I'm not...
What do you find funny about this?
I don't think it's funny in the slightest.
Why do you keep laughing then?
I'm not laughing at all.
I literally just asked you, is it true that 4,000 elderly people have died in hospital and all you can do is laugh? What's the matter with you?
I'm not laughing. Please don't suggest for a minute that I'm laughing.
We literally just saw you laughing.
I have not been, but it feels like you're shouting at me, not giving me a chance to answer.
I've asked you a question 3 times now. You won't answer it. Is it true? Let me try one more time. Is it true that 4,000 people, elderly, vulnerable people, have died of coronavirus in our care home, as the Daily Mail front page says?
So the data we have from the ONS, which is the source of robust, reliable data, tells us that up to April the 3rd, 217 people died of coronavirus in care homes. I believe, because I've been talking to care providers and representing the care sector, that since then, very sadly, more people have died in care homes.
How many?
And we are working to make sure that we have that data, but it's really important that our data is accurate and timely.
Well, how many more do you think may have died? Give me a ballpark.
No, I don't think it's appropriate for me to give you a ballpark figure for something as serious as this.
So quite different styles of interviewing there, and we do combative political interviews as well, but this doesn't necessarily feel like it's the right subject for that kind of approach, and the audience seemed to feel that was the case. Audiences want human stories too. Actually, I had the chance, and this was a sad moment actually. I had a close friend die of COVID-19. I actually made a piece about that for my own radio program. This was also a piece which went down very well with audiences, and it just, I play it just to sort of give a sense of how you'd never normally see this kind of thing on the news.
And finally, some good news for you about someone who tested positive for coronavirus and has recovered. It's George Alagaya, and as many of you will know, he has stage 4 cancer. He has undergone more than 60 rounds of chemotherapy and is still having treatment. It puts him, of course, at a much higher risk than most people. 2 weeks ago, he went into hospital and tested positive. Thankfully, he is now back home, and this afternoon I spoke to him about his experience.
They did loads and loads of tests for all kinds of things, one of which was COVID-19 coronavirus. And a few days later, I think 3, 4, 5 days later, my oncologist phoned up and said, well, you're fine as far as the chemo side effects are concerned, but you do have COVID-19. And actually, my first reaction was, well, actually, if that was it, then I've got away with it, because I had a temperature, but I didn't have all those other really nasty things that people talk about. Right now, last couple of days, I feel not back to normal, but certainly I feel well.
You were one of the people we were most worried about when all this began. You've got stage 4 cancer. I mean, I've had numerous conversations with you here in the newsroom, and we were really worried about you.
It seemed a very anxious time. And actually, my friends like you were getting more anxious, I think, than I was, because, to be honest, if you've been living as I have for 6 years, with scans every 3 months, and the whole uncertainty, and sometimes in a very life-threatening way, this didn't seem so bad to me.
That's my BBC colleague George Alagaya giving a very personal account of his encounter with COVID-19, and people have appreciated that. It's not something that we would normally do in a news programme to show any side of the character of one of the newsreaders, but it seemed appropriate and people like that. We've had some very hard-hitting stuff which is actually quite hard to watch. Just take a look at this.
We now have a rare insight into conditions at one of the biggest facilities in the UK. This is University College Hospital in central London. And this special report is by our medical correspondent Fergus Walsh and cameraman Adam Walker.
It is completely unimaginable, and we're not at the peak yet.
This is the front line in a war.
Apart from 2 patients, every patient we're looking after has got COVID. We can't cope with a big spike. We just can't.
Every day, some battles are won,
It's one of the doctors here.
and some are lost. All the patients here are critically ill.
We're planning for many more patients, so all our theatres to be full of COVID patients and possibly beyond. It is, none of us have ever seen anything like this.
This used to be a recovery area for patients after surgery. Now it's an intensive care unit for COVID-19 patients. A huge part of the hospital has been transformed in order to deal with coronavirus.
I've been in intensive care nursing for about 23 years now, and I've never seen anything like this. Even the London bombings, never seen it in such a short, condensed period of time.
That's our medical correspondent, Fergus Walsh. And just the hoops they had to jump through in order to be able to film a piece like that in order not to get in the way of the medical staff, while keeping themselves safe. It has been, it comes on to this final point, the future. Now if we interview people, increasingly we're doing it down the line. You see the use of video conferencing on our regular TV services, not just for the interviewees, although that has become mainstream, because going out and meeting people at the moment is not considered, in most cases, safe. And if you do, you have these extraordinary distances between the interviewer and the interviewee, but also even the presenting of programs is being done down Zoom lines, as well as our regular broadcast lines. It means any house in the world, pretty much with the internet, can go live on major television networks. It's not just us, it's everyone. And of course, the other thing, the reason I have this picture of the BBC's Central London headquarters here is because it has completely changed the way we work. I feel quite fortunate in that I'm one of the few people left going into that building every day. Normally there's something like 8,000 people in this building. We're now down to, across a 24-hour period, maybe 300 or 400. It's only people who are considered absolutely broadcast essential who come in. And increasingly members of my team are having to work from home, because the BBC has always had something of a role of maybe an exemplar in British society. And so the fact that we've not closed down, the fact that we've kept on going through this, means that, in fact, we've got experience of what it's like to work in an office at a time like this, what it's like to have the social distancing. We were putting in the one-way systems in our office before, while most offices in the UK were still closed. So these are very interesting times. The future is very uncertain. How international travel will restart in this climate is a story yet to be told, but the BBC will be there to tell it. Before I sign off and take questions, I will just say, I mentioned it at the start, always interested in stories from the people I meet. It's a real delight to be speaking to you in Las Vegas, which is a place where, goodness, you have some of the most interesting people in the world passing through your city. I have almost the attitude of a priest to this. You can always tell me anything. I will never put something that you have told me on TV or radio unless you're comfortable with me doing it. But if you ever have a story that you feel should be of interest to a global audience, do message me. The Economic Club of Las Vegas, I'm sure, will pass on my contact details, but I'll give you my email address now, which is alex.ritson, R-I-T-S-O-N, @bbc.co.uk. And with that, I would love to take your questions.
So we have quite a few questions, so let me get started right away. First off, thank you for that. It was really a terrific insight into what it is to cover the news on something as dramatic as COVID-19 has been. I have questions about the United Kingdom, some questions about COVID, news, a lot of people asking questions about China, President Trump, and the World Health Organization. So I'm going to try to lump these into several questions. First question was, does Boris Johnson ever comb his hair?
I think Boris Johnson is aware of a brand. He has made a brand, and it would not do him good. I suspect this is the way he feels. I don't know the man personally, though I have met him. But just knowing the way people who are in the media tend to operate, I think he has decided that this is the Boris Johnson look. People know him for it. And so, no, combing his hair would probably be bad for his image, although it tends to be good for other people's images.
But all kidding aside, the follow-up question to that was, there was a marked change in his position towards how the UK ought to be handling coronavirus after he had his own run-in with the disease. Can you talk about that, please?
Was it connected? I don't know. I mean, in the end, whether a country has done this well or has done it badly isn't for us to say, and probably isn't really for anyone who is watching it to say at the moment, because it's not over. We're not going to know until this crisis is finished which governments actually got this right and which governments got it wrong. I'm reminded, it was a news story at the time, but President Trump said, we don't want the cure to be worse than the disease. And that was an immensely controversial thing to say for some people, because they saw this as, well, President Trump is putting the economy before people's lives. But, you know, every government is having to wrestle with this. There's the economy on the one side and there's people's lives on the other. And if you completely wreck the economy, then actually you're going to put people's lives in danger too. So many governments are wrestling with the same thing. And I think Boris Johnson knew that the death rate in the UK was on a very, very nasty upward trajectory when he came out of hospital. He'd had his own brush with it, so maybe understood it from a personal basis more than he did before. But goodness, it was an opportunity to show that he was listening. If he wanted to make a change, it gave people a reason to understand that change. Was it why he did it? I don't know. I mean, he's got a whole team of people around him. They will have known that things didn't look like they were going well, and they will have known that was an opportunity that was presented. Is it real? Is it Memorex? I don't know. All we do is report what we see as accurately and fairly as we can.
So a question, the US has more reported cases than any other country, which I'm going to sum up a few people who wrote in different questions, which seems odd considering there's 300 million people in the United States, 1.6 billion in China, and about the same amount in India. So the question is, are there actually more cases here, or are we testing more, or are we the only country telling the truth?
And the answer, unfortunately, is I really don't know. But because of that, we know we don't know that. And so when we report that the US has the highest number of confirmed cases, we generally will add in the line that is because the US, that they are confirmed tests. And it's not really comparable with other countries, because there are many countries that are not doing anything like the level of testing that the US is doing. What I did, though, point to in my presentation was that other figure from the World Health Organization, still not perfect, but the death rate per million population. And it's not a great figure for the US, but there are other countries which are worse off, unfortunately, including the one I'm sitting in.
I see. Would you please talk to China's responses to the Wuhan flu? Someone is absolutely determined that I would call it the Wuhan flu today. So in the series of questions I have here about how China didn't come clean early on, and then there were internal travel bans, but international travel was permitted. Someone asked the question, did China intend to spread the virus so they wouldn't be the only country suffering economically? Someone else also wants you to talk about human rights atrocities in China, and there's more. So please, what have you, from your perch in the BBC newsroom, what have you seen regarding China?
Okay, well, we haven't seen any evidence that this virus came from a laboratory in China. There have been people in the intelligence community who have made these claims. These claims have been made by President Trump and by Mike Pompeo, but the CIA have distanced themselves from these claims, and there will always be, in any situation, there will be conspiracy theorists. As a general rule of thumb from my journalistic career so far, this is really useful, actually, remember it. If it's a choice between cock-up and conspiracy, 99 times out of 100, it's cock-up. Now, that doesn't mean it's not a conspiracy. 1% of the time it is, but there are people out there who will believe any conspiracy theory that's going around, and they're almost impossible to argue with, actually, because the instant you start saying, well, there is no evidence, they'll just say, well, that proves it, doesn't it? And it just, you simply cannot win. So we've not seen any evidence, and we get all the same stuff being shared on Facebook and on Twitter and email from people we know as well. And every time supposed evidence comes before us, it does get checked out by our fact check team, by our health and medical correspondents, by our science correspondents, by our, we've got an enormous news gathering network. And what we want to do is give as fair and accurate a picture of what's going on in the world as we can. And as far as I know, none of my colleagues have seen any evidence that the virus was manufactured. When you look at the way China dealt with it, well, the other thing that sort of I would tend to say here is that hindsight would be such a fantastic thing if only you had it in advance. You know, I remember I was actually working the night it was back in December when the first cases of COVID-19 were being reported, and it was just a few dozen people at the time, but there was a British, I think it was 170 people, and there was a British group of scientists that made it enter our bulletins for the first time because they said, we think the scale of the disease is 10 times what the Chinese officials are saying. Now, were the Chinese trying to cover it up? Well, no one knew what it was going to turn into. It's the first time we've had a pandemic on this scale in the lifetime of most people. Yes, we've had the SARS and MERS, but they didn't reach the Western world, and they didn't reach everyone in East Asia either. So people were dealing with this for the first time. Now, was this something that has a more sinister background to it? Well, I don't know. But as I say, I've not seen any evidence that it is. And I think the starting point with most countries is probably they're trying to do the right thing. It might not be. And if we find evidence that they're not, then it'll be the top story in our news programs. But I've not seen that evidence yet.
Okay. Another question. How do you in the newsroom or BBC or just as a professional journalist determine how to cover something that is somewhat less grounded, like some of the comments that have come from President Trump? And is there a responsibility to interpret with context to try to avoid social overreactions?
Well, of course, when we report President Trump's comments, we attribute them. We're not saying this is true any more than we say that anything anyone else says is true. But the fact that he says them is newsworthy. If it's something, I think the thing I find most extraordinary about President Trump is his ability still to amaze me. That he can just come out with something that even now, even after he has pushed the boundaries of what the President of the United States in times past would have said. And he is able to grab the top spot in the bulletin, even though quite often what he's saying is not grounded in evidence that he's ready to share with us. But it is still just extraordinary. I see people in the newsroom whose jaws will drop to the floor at some of the things that he says. Now, he's the President of the United States. We would like to think that he's well informed. He has, the biggest intelligence networks, the best funded intelligence networks in the world behind him. A lot of people who watch that would like to think that what he said is grounded in fact, but he doesn't necessarily share the evidence that leads him to those conclusions with us. And when he doesn't, we will point that out. We will say it's something that he says, but that the evidence perhaps hasn't been shared for a particular claim. And of course, probably the most notable example of this recently was the hydroxychloroquine, when President Trump said that he was taking that. But there were a large number of medical professionals who questioned whether that was a sensible thing to do. And President Trump wasn't able to share the medical evidence that supported his claim. Now, I don't know. I'm not a doctor. I don't know whether hydroxychloroquine can prevent people getting COVID-19. He's the President of the United States. If he says so, then it ought to be reported. But it ought to be reported and was reported with the qualifiers, and until such time as the evidence is there. And even then, it takes a very long time before a fact is so established that we would report it without attribution, because that's not what we do. We report the facts and we attribute. We have to have our sources, and the BBC itself doesn't really have a position on anything.
The last question, we are running out of time, so I'm going to ask one last question, and it's about your position as a news person. And I'm going to take a few, so please be patient as I try to coalesce these together. Does public opinion dictate what you cover? And when you have to cover something that seems so awful and so tragic, how do you talk about your struggle to maintain professionalism while you're trying to sort through news, sort through memes, and sort through public opinions to facts that, as you said earlier, hard-hitting facts that people might need to hear?
As to how something gets to the top of the bulletin, those two basic questions that I mentioned at the beginning, is it interesting? Is it significant? The answer has to be yes to at least one of those, but really both, in order for it to get into our bulletins. And then it's up to the individual judgment of the journalists who are working on any particular day. But the interesting thing is, we are some of the most experienced journalists in the world, and I have many more experienced people than me in the newsroom around me, editing my programs, and taking their positions in the center desks. But you do, when you've been working as a journalist for a while, you do come to know whether a story is news, and also what place it would have in the bulletin when compared to the other stories that are around that day. It is an experience thing, but if you were to ask 10 journalists, and this would be true of journalists at other organizations as well, although, of course, not all publications or broadcasters subscribe to the same. We try to be impartial, others have a definite position on things. But certainly within any organization, the journalists get to know what is news for that organization. And if you gave them 10 stories, almost always, I suspect they would put them in more or less the same order. There might be, odd, one slightly higher than the other, further down, but most times we would know what the top story is. And you'd be surprised also just how much, even if you compare rival news organizations, just how often actually the news agenda is the same. The only thing that will really change it is where one particular news organization has a scoop, a story that for the moment only they have, and then that might then trump, in the old sense of the word, trump all the other stories and go right up at the very top. The question, though, about the effect that the news has on people, well, I mean, this is, I mentioned it was like reporting a war, and I have seen colleagues really struggling with some of the footage that they've had to watch, some of the accounts that they've had to read, some of the people that they've had to speak to. I've done very distressing interviews through this process myself. We have, because we are fortunate enough to work for the BBC, which has been doing this a very long time, we have a very good mental health support system behind us, and we know who and how we can reach out to. And PTSD is a real thing. It's not just soldiers that get it. Actually, journalists can get it too. Journalists, particularly who go into war zones in regular times, have suffered horrendous mental anguish as a result of some of the things they've seen. And I have colleagues who in previous times have had been working with camera people who've been blown up, and they've watched it happen. And that's just the personal stuff. The people who we work with who go into Iraq, Afghanistan, parts of Africa, see this stuff happening to other people. And yeah, it's immensely distressing. But if you go into this profession, trade, whatever you want to call it, it does go with the job. And it was interesting at the start of this crisis, just seeing, I think all organizations will have seen this. There will have been some people who found that it was tough for them, and you maybe saw a bit less of them, but the vast majority of people who worked in the BBC newsroom and in newsrooms around the world, this is what we trained to become journalists for, and they've stepped up and they've been there. Because if I go back to the funding argument that I mentioned at the beginning, if the BBC can't do this story well, then what is the point of having the BBC?
And I think that is a terrific answer and a wonderful point, and perhaps a terrific ending point for today. I want to thank you for your time. You've been incredibly generous with not just your time, but also with your opinions and your perspective. So thank you for that.
It's my pleasure. Thank you so much for having me. And yeah, it's been a real, I look forward to my next visit to Las Vegas once the restrictions because of the pandemic are ended.
Perhaps the next time we'll have you in person instead of by Zoom. I want to thank everyone else for the questions. They were really terrific, and I'm sorry I didn't get to all of them. There were really so many good questions, and yeah, we'll have to get to it on the next one. And stay tuned, guys. Our next event is when we host the president of the San Francisco Federal Reserve Bank, Mary Daly, and that's coming up in August. So we'll talk to you soon, and thanks for tuning in. And again, Mr. Ritson, thank you very much.